redness in the sclera or the conjunctiva, except the middle corneal part. So what are the causes of the red eye? The red eye may be because of the increased blood within the blood vessels due to the dilated normal blood vessels, which is due to inflammation or increased blood flow, or because of the abnormal blood vessels, like in benign lesions like pterygium pingecula, or in malignant lesions like the squamous cell carcinoma, or it may be the blood outside the blood vessel, like subconjunctival hemorrhage. So this is the hyphema in the blood in the anterior chamber. This is the subconjunctival hemorrhage, and this one is the conjunctival hyperemia. So today we'll be talking mostly about the conjunctival hyperemia. The main causes of red eye are, there are transient causes like due to allergens, air pollution, smoke, dust, fumes, and there are some common eye conditions like conjunctivitis, computer vision syndrome, and episcleritis, or serious eye conditions like trauma, anterior-uveitis, acute glaucoma, keratitis, corneal ulcer, or scleritis. So how to approach the red eye? So we should be knowing the history. In symptoms, we should be knowing the pain, sensation, redness, itching, diminution of vision, discharge, and the time course. Events at the onset of symptoms, how the symptoms started. Was it by some foreign body or trauma? What were the alleviating and worsening factors, and the prior treatment and its response, and contact history, like anyone in the family or classroom or the workplace had red eyes recently. So in examination, should go from lid lashes where there is lid swelling, or there is matted eyelashes. We should also look for the preauricular lymph nodes, and we should see the what kind of discharge it is, watery, purulent, or mucoid, and also see for the hemosis, subconjunctival hemorrhage, and pattern of redness, whether it is sectoral, diffuse, or circumcorneal. So the discharge, it may be watery discs like this in a allergic conjunctivitis on the top left, and it may be purulent like this, which is usually due to bacterial, and this is a viral conjunctivitis, again marked hyperemia. This is again a bacterial conjunctivitis with purulent discharge. So part after seeing discharge is the type of congestion. How is it congested? Is it sectoral or the diffuse congestion or circumcorneal? Sectoral congestion. These are the screen. Sorry. These are sectoral congestions. The top figures are sectoral localized congestions, and on the below figure, this one is the congestion, and the right one is the circumcorneal congestion. The circumcorneal congestion signifies a serious disease, like usually of anterior chamber origin, like acute glaucoma or acute iridocyclitis or endophthalmitis. So while looking for the different type of conjunctivitis, we should see the discharge, whether it's watery, mucopurulent, or stingy. In viral it's watery, bacterial it's mucopurulent, in allergic it's stringy mucoid, rope-like. In erythema viral it's mild, and in bacterial it's moderate and severe. In allergic, mild, moderate. And itching is the characteristics of allergic conjunctivitis, and lymphadenopathy is characteristic of viral, and upper respiratory tract co-infection is found usually in the viral infection. So I think this slide didn't come. This slide I was talking, it was not displayed. So we should know about the circumcorneal congestion and the diffuse congestion. So these are very important. This is the below right one is the circumcorneal congestion, which signifies the disease of the anterior chamber like glaucoma or anterior uveitis, and this diffuse congestion is usually because of the conjunctivitis. We should be able to differentiate between the circumcorneal and the diffuse congestion. In the diffuse congestion, it is usually in the pharyngeal area and it fades towards the limbus. And in the circumcorneal congestion, the congestion is mainly around the limbus, it fades towards the fornix. And the diffuse congestion is because of the of the conjunctival vessels, whereas the circumcorneal congestion is due to the congestion of the anterior ciliary arteries. So these are the main points we should be able to distinguish between this diffuse and circumcorneal congestion, and also type of the discharge, which I have already told. This is the type of discharge. And on the basis of the type of discharge, whether the lymphadenopathy is present or not, and the type of the conjunctive injection, we differentiate the type of conjunctivitis as already described. So now we are in the house because of the COVID-19 pandemic. This is the SARS-CoV-2 virus causes the COVID-19, and it's a talking about the red eye, we should be knowing what SARS can cause to the mankind. Like, I'll go through few literatures. There are a lot of literature like clinical characteristics of coronavirus 2019, coronavirus presenting with conjunctivitis as the first symptom, characteristics of patients with COVID-19 in way, ocular manifestations of the confirmed COVID-19, conjunctivitis and COVID-19 meta-analysis. There are a lot of literatures regarding what coronavirus causes in human. So the causative agent of COVID-19 is SARS-CoV-2, and it attaches to the ACE receptors, angiotensin converting enzyme 2 receptors, gain entry into the mucus and then infect host cell. In the experimental models, like in the cats and mice, it was able to cause conjunctivitis, anterior uveitis, retinitis, and neuritis. So wherever the ACE2 receptors are present, they will be able to infect there. So till now, from the it is seen that in human it only causes the acute conjunctivitis. So proposed theory of eye involvement is direct inoculation, droplets over the conjunctiva, migration of the upper respiratory tract through nasolacrimal duct of the eye, or maybe a hematogenous spread to the eye. So now let's look at acute conjunctivitis has been seen in different places. So one study has showed that conjunctivitis to be prevalence of 0.8%, 9 out of 1099. Another study has showed 12 out of 38 patients had conjunctivitis, it's 31.6%. In the first case, conjunctival swab was not sent for PCR, and in this second study, 2 out of 38 patients were positive, could demonstrate SARS-CoV-2 virus in the conjunctival swab. So in the total, it comes out to be about 5.2% of the case samples. It was positive in tears. In another study, 1 out of 30 has conjunctivitis. The same had positive in the tears also. So in another study, it was done not irrespective of the presence or the absence of the conjunctivitis. It 64-tier sample from 17 persons between 3 to 20 days, they could not find any SARS-CoV-2 virus in. So it's the incidence is varies from now available literature 0.8 percentage to 3.33 to 31 percentage, and the virus isolation in the tiers is percentage to 3.3 to 5.2 percentage of the total conjunctivitis. So whenever there is red eye, we should be cautious because it may be the present feature of the COVID-19. So this was a photograph of a patient which was taken during teleconsultation, and he had left eye conjunctivitis as the presenting feature of the COVID-19 disease. So after consultation, few hours after consultation, this patient experienced intense headache, developed fever, and dyspnea as well. So we must be very careful. So what are the signs of COVID conjunctivitis? There will be, as it's also a virus, as actually SARS-CoV-2 is a negative sense RNA virus of corona family. So like any other viral conjunctivitis, it causes mild follicular conjunctivitis, maybe unilateral, later becoming bilateral. There will be watery discharge, eyelid edema, and bilateral chemosis. And it was seen in the ICU patients, bilateral chemosis was the only ocular sign. So how to suspect that a conjunctivitis may be a COVID-19? So he may have fever, sore throat, cough, short breath, chest pain, tiredness, lethargy, loss of smell or taste, feeling confused, or maybe diarrhea and nausea. So with this, now if we need to differentiate COVID-19, dry eye, allergic pink eye, and bacterial, the main feature is the other symptoms like associated fever, tiredness, cough, or the other symptoms, and the preauricular lymphadenopathy. So in the management of all the conjunctivitis, whether bacterial or viral, except for the allergic, frequent hand washing and eye washing is to be done. We should not share the personal care objects like towel, cosmetics, avoid contact with eyes, avoid shaking hands, and strict instrument disinfection in the hospital and OPD. In hospitalized patients, viral cases of viral conjunctivitis, they should be kept in isolation for 10 to 14 days. The medical treatment is cold compressions, artificial tears, non-steroidal anti-inflammatory drugs, and antibiotics. So in red eyes, the red eye may be a sight-threatening condition. So what are the signs of sight-threatening? If there is a sudden loss of vision, if there is diplopia with trauma, if there is photophobia, and if there is vomiting and pain, this may be a simple red eye, it may have other associated features. It may be acute conjunctivitis, acute iridocyclitis, or uveitis, or acute glaucoma. The main differentiating point is the and the conjunctival explained. Purulent discharge in acute iritis, acute glaucoma, there will be least amount of discharge, rather there will be reflex watering, and photophobia will be severe in acute iritis and acute glaucoma, and IOP will be raised in glaucoma, and it will not be raised in acute conjunctivitis, sometimes may be raised in acute iritis, and the pupil will be fixed and dilated in acute glaucoma. In acute iritis, maybe because of the posterior synechia, the pupil may be small, festooned. In acute conjunctivitis, the pupil will be round, regular, and reacting. So these are the differentials of red eyes. So now coming to the summary, by what we have seen, this is Dr. Li Wenliang. He was the first ophthalmologist or whistleblower who told the world about the COVID-19 spreading in Wuhan, but unfortunately he died. He's not with us. He succumbed to COVID-19. So whether virus in tears is doubtful, but it is possible that the virus can transmit through the tears as well. There is another case where Guang Fawang, a clinician in Wuhan, was infected even with wearing N95 mask, but he was not wearing any eye protection. So it is speculated that his conjunctivitis developed via tear or conjunctival pathway and later developed pneumonia, and he also died. So in any case of red eye, we should approach it as a suspected COVID or as a COVID-19 patient with all the precautions. Whenever the patient presents with acute conjunctivitis or red eye, special consent as formulated by Nepal Ophthalmic Society is to be taken. Then we should take the history of fever. We actually check the fever and also history of fever, history of travel. Now the history of travel to the endemic parts become relevant, like history of travel to the hot spots, occupation, history of contact, or whether he is from the cluster, or there is the presence of this anosmia or ageusia, that is recent loss of smell or the loss of taste. So if these are positive, we send them to the COVID center, and if these are negative, we still treat them as a COVID suspect. So for treating red eye in this COVID pandemic area, there should be an isolated room. The person treating should wear full PPE and should give the treatment of conjunctivitis. And also, the patient should not be allowed to mix with the rest of the patients. Whatever counseling and medication to be given should be pre-packed and to be dispatched from that isolated room itself, so that the patient doesn't go and go to the pharmacy and be in the queue or go to the other places. So they should be dispatched from the isolated room, and the treating doctor or paramedics should wear the full PPE. And even if the case is negative with the above FTOCC history, we still treat them as a COVID suspect and ask them to self-quarantine for 14 days. And we'll take their phone number and review them on the phone on 7th day. So if that patient was as a COVID-19, so we will be knowing by that time what his situation is. And in this COVID situation, it is better to avoid oral NSAID and topical steroids. And if there is pain, we should give paracetamol instead. So in conclusion, there should be frequent hand washing and face washing, physical distancing, maintaining the social intimacy. Acute red eye should not be ignored, and danger signs should be looked for. COVID-19 does affect eye and maybe the presenting conjunctivitis may be the presenting sign. So we should take due precautions. And I would like to thank Ms. Optum Kapil Gautam for giving this opportunity. And I would like to acknowledge Dr. Aditya Prasad for helping make this slide, make this presentation. Thank you.
Thank you so much, sir, for such a wonderful presentation, and for all the attendees for their participation and for the passion as well. So now we are heading towards the discussion session. Let me check out the question you have raised on the chat box. Okay, so there is one question: why ophthalmia neonatum is kept separate entirely in the conjunctivitis? Hello, Purushottam sir. Am I audible to you, sir?
Yes, you are audible. Yeah.
Okay, sir. Should I repeat the question, sir? Sir, why ophthalmic neonatum
yeah. It is not the usual conjunctivitis. It is the conjunctivitis of the newborn, like the neonates. And here, so that's why it is kept separately. And also, it is the one of the ocular emergency. That's why it is kept as a separate entity. And it not only affects conjunctiva, it also affects the cornea. So if not taken care of in time, it will cause corneal melting and the eye could not be salvaged.
Thank you, sir. So there is another question from the Rudip Raut. He is asking for, sir, why topical steroids should be avoided in the COVID-19 red eye?
Because the steroid will cause immune suppression. So when there is decreased immunity, the virus can get easy access. That's why.
Okay, so I guess we have answered the most of the questions. If anybody have the question, please you can unmute yourself and ask the question to the our presenter. Or if you have any question, please pop out the question on our chat box.
Hello, Namaste, sir. Sir, Namaste.
Yes,
Namaste.
If someone wants to do research on COVID patient regarding in ophthalmic entity, then what are the criteria that we can do on this topic?
I didn't get you. What are
if someone wants to do research on COVID patient in Nepal, is there any criteria regarding this?
okay, Ananda sir, I guess your voice is cracking, and can you please make sure that your microphone is near to your mouth and speak make it a little bit louder?
So what was the question?
I guess he is asking for.
Sir, yes, if someone wants to do research on COVID patient, is it audible?
Yeah, so yeah, audible, yeah.
If someone wants to do research on COVID patient regarding in ophthalmic eternity, then what are the criteria, what are the concentration during this research, sir?
Oh, so uh, the COVID confirmed patients, Nepal now there are about 1,000. So if they want to, they should get the prior permission from the isolation center where they are placed, and with proper PPE and due precaution, they can do the research. First, they have to get the ethical clearance from the isolation center where the COVID positive people are placed, and then they can proceed.
Is there some specific guideline from ophthalmic society, sir, for this research
Actually,
on
no such
COVID?
guidelines from ophthalmic. Yeah, no such guidelines.
Okay, sir.
The researcher should also be protected, and the confidentiality of the COVID patient is to be maintained, and the isolation center should give permission, and we should stick to the declaration of Helsinki and the other ethical clearance.
Sir, thank you.
Okay, sir. I guess we have answered the many of the questions. So there is one question from the Manoj Mahat. Apart from the conjunctivitis, is there any cases reported till now affected other part of the eye? I guess Manoj are asking for the COVID or anything else. Can you please make it a little bit clear?
Yeah, till now only conjunctivitis is the only ocular manifestation reported.
Okay, sir. Okay. Okay, there is another question from the Asta Sumidi. He's asking for how should we approach for ophthalmic evaluation with conjunctivitis COVID positive patient.
So if it is a confirmed COVID positive patient, the practical way would be to take the vision first, and the vision is good, pupil is reacting, and there is conjunctivitis. We can empirically give medication like antibiotic, artificial tears, lubricants, and ointment at the night, and ask her to fall, and then we shall call her in 7 days. Usually most of the conjunctivitis which are viral are self-limiting, and the bacterial also, if we put medicine regularly and timely, it gets healed. So if it is a COVID positive, COVID-19 patient with conjunctivitis, we can see for the danger signs first, like whether the pupil is reacting or not, whether there is decrease of vision or not. And vision is 6, then we can just ask her to put medicines, not to examine her, not to examine the patient, and then ask her to follow up in 7 days.
Okay, I guess there is one question from the audience. So most of the optometrists are having a difficulty in differentiating between the circumciliary conjunctivitis and diffuse type of congestion. So how to separate between these congestions?
The diffuse type of conjunctivitis, diffuse congestion is mainly in the fornix area, and it feeds towards the limbal area. And the circumciliary congestion is mainly in the limbus, and it fades towards the fornical area, and the circumciliary congestion is centripetal in orientation, whereas the diffuse congestion is centrifugal.
Okay, sir.
And
So
this
yes.
This conjunctival congestion, it blanches on pressure, whereas the ciliary congestion usually do not blanch on pressure. And also the disease also, so those said mild iritis, there will be some other signs also in the anterior chamber in the circumciliary congestion.
Okay, sir. So there is another question from the Ajay Kumar Paul, sir. What are the main different signs and symptoms of conjunctivitis by COVID positive patient and other bacteria?
From bacterial, it is very easy to differentiate, because bacterial there will be mucopurulent discharge, and from other viral it will have the same signs like follicular conjunctivitis, watery discharge. But in other viral also we may have sore throat and upper respiratory tract infection. But in this COVID positive conjunctivitis, there may be associated shortness of breath, chest pain, increased fatigueness. These are the signs, and also fever.
Okay, so there is one question from the Manisha. What is the treatment for red eye due to the pterygium?
Red eye.
Yes, sir. What
Red eye
is
due
the
to
treatment for redness? What is the treatment for redness due to the pterygium, sir?
red is it's mainly, you see how big the pterygium is, and the initial treatment for red eye would be artificial tears and NSAIDs, and the confirmative treatment would be the excision of the pterygium. If it is big, crossing into the visual axis, or even if small, it is causing pannus in the cornea or causing inflammation in the form of conjunctivitis. Better to excise it. But for the redness, maybe NSAID, artificial lubricants.
Okay, so there is another question from the wrinkle, sir. Sir, is conjunctival swab taken in the case of presentations with the conjunctivitis in the hospital in Nepal?
No, not done. Here only throat swab and nasopharyngeal swab are taken. Now only we are having the test centers at 7 places. Previously it was only in the Teku. Maybe with abundance of kit and the manpower, we'll be able to do it.
Okay, sir. Sir, what is the reliability? What is the if we use the oculist in case of pterygium? Can we use the oculist in case of red eye due to the pterygium? This is the question from the Manisha.
Yes, you can use the oculist. It will give the soothing effect, and also it will vasoconstrict. Redness will be decreased. You can use it. But the confirmative treatment, if there is prolonged redness, then it's better to remove the pterygium.
I guess we have answered many of the questions. So if anybody have a question, please you can unmute yourself and ask question to the sir. Okay, I guess we have answered many of the queries, and considering the time limit, here I announce the closure of the discussion session. Before ending the today's session, I would like to express my sincere gratitude towards the presenter, Dr. Purushottam sir, and all the attendees. And also, I'd like to appreciate all the helping hands for our test program. Herewith, I'm ending the today's session, requesting all you please give your review and feedback. So, I guess there is one question from
Yes,
the.
thank you very much.
Yes, sir. Okay, sir.
Okay.
So still there is one question, sir. What is about antihistamine eye drops used or not in the conjunctivitis?
Yeah, you can use it in the allergic conjunctivitis. We are using ketotifen. We can use it in the allergic conjunctivitis. But for the viral conjunctivitis and the bacterial, NSAID also has antihistaminic effects. But antihistaminic eye drops are especially for the allergic conjunctivitis. We can use it.
Okay, sir. I guess we are about to end up the presentation, sir. If you want to give us some message to our platform or all the attendees in the is a good note, sir.
Okay, thank you very much for giving me this opportunity to all the listeners as well as the organizers. And I regret for the earlier about 15 minutes technical disturbance. And thank you all. Thank you very much.
Thank you, sir. Have a good day, sir.
Okay, thank you.
Okay, sir. Herewith, I am ending the today's session. Thank you so much.
Okay,
Thank you so much, everyone.